he's heard that some people may be more sensitive to allergens or to things in the environment after chemotherapy or treatment for cancer. And I think there are a couple of things to think about. It depends on what type of therapy they're on after their treatment is over, because some people, for instance, may have organ transplants, or they may have had a bone marrow transplant, and they may be on continued immunosuppressive drugs. And some of those do have side effects of light sensitivity, so you're more likely to have sunburn or some other skin changes just due to the medications that you're on. Also, if you're on immunosuppressive therapy, or you've had immunosuppressive therapy with your cancer treatment or chemotherapy, then that will make you more susceptible to infections. So that's a very big risk factor, because the treatment that you're actually receiving, or the treatment that you received, knocked out your ability to fight off certain infections. So I think that there is some truth to that. So I'll just leave it at that.
I have a question. All right, so lupus, I'm under the impression that lupus is an autoimmune disease, but I'm also under the impression that people with lupus should not spend a lot of time in the sun. Is that accurate?
Well, lupus is an autoimmune disease that can affect you in lots of different ways. It's basically the body or the body's immune system overreacts or starts to react to our own proteins or ourselves. Usually the immune system, if it's working properly, its purpose is to protect us from foreign things. So when you have an autoimmune disease, your body actually reacts against itself, and lupus is one of those diseases, and it can affect pretty much any organ in the body, kidneys, lungs, eyes, but it can also affect the skin. So some people that have lupus that manifests in the skin do have to stay out of the sun. But just as a blanket statement saying that all people with lupus have to stay out is, I don't think, accurate.
As a follow-up to that, I am under the impression as well, which again may be mistaken, is that if you have poison ivy, you should also stay out of the sun, which is No,
I'm not so sure. The sun is actually used, and light can sometimes be used as therapy for some chronic skin conditions. So there are clearly some people who should stay out of the sun because that's going to worsen their condition. There are other people who may undergo therapy called PUVA, and it's using light rays to reduce some of the reactions. Now, I'm not a dermatologist, but light waves can sometimes be used as a treatment. Let me go back to this question again. It's a tangential thought here, but we do sometimes use medicines that are used in chemotherapy, and use medications that are used to prevent organ transplant rejections in the treatment of some of the diseases that we treat. For example, there's a condition called chronic urticaria and angioedema, or chronic hives and swelling. And in a majority of those people who have these hives that last for more than 6 weeks, there appears to be certain antibodies, non-allergic antibodies, but antibodies that trigger the release from cells in the skin of chemicals that make it look like that it's an allergic reaction. So we as allergists see a lot of these patients, and occasionally I have a patient right now who's taking a medicine called cyclosporin A, which is used in people who've had organ transplants to prevent rejection. The idea is you're purposely decreasing their immune response to try to prevent these antibodies from triggering outbreaks of hives, which are miserable. So again, a tangential thought, but we actually do use some chemotherapy and immune suppressant agents in the treatment of certain conditions that we see as allergists.